Many caregivers for people who have dementia are often the family members and are also the adult children of those diagnosed. Sometimes it is hard to know what is happening to mom and dad as they journey through their lives with dementia. This video will hopefully help explain a little bit more about dementia and will bring up some more important information for those caregivers. Many of you may be wondering what exactly dementia is. Dementia is defined as a general term for the loss of memory and other intellectual abilities serious enough to interfere with daily life. Alzheimer's disease is the most common form of dementia, and it accounts for 60 to 80% of dementia cases. The basics behind what is going on in the brain for someone with dementia is that the disease leads to large amounts of cell death and tissue loss. Over time, the brain shrinks in size and many plaques and tangles are formed. Plaques can be described as abnormal clusters of protein fragment which build up in between nerve cells. Tangles are twisted strands of protein that surround the dead nerve cells. It is unknown what exactly causes cell death and tissue loss in the brain, but research suggests that tangles and plaques are the ones that are the culprits. Why should we care about dementia? 1 in 9 older Americans has Alzheimer's disease. Women are 2.5 times more likely than men to provide on-duty care 24 hours a day in the late stage of the disease. 1/3 of all seniors who die in a given year have been diagnosed with Alzheimer's disease or another dementia. The most important thing for caregivers to know is that they are not alone. There are tons of organizations out there who are willing to help through the stages of the disease. Changes to expect in your loved one include repeatedly asking the same question, becoming lost or disoriented in familiar places, being unable to follow directions, having difficulty with routine tasks such as paying the bills, neglecting personal hygiene and nutrition, and lastly, being disoriented when asked the date or the time. Five tips to become a better caregiver. Number 1, ask for help. Number 2, schedule time away regularly. Number 3, exercise, with or without your loved one. Number 4, join a support group. And number 5, use humor every day. And remember, do not neglect yourself.